Imagine you're sitting at a cafe, sipping coffee, when suddenly your chest tightens, your heart pounds as though it's trying to escape, and you're convinced something catastrophic is happening. You might be experiencing a panic attack, a sudden storm of fear that feels uncontrollable. But what causes these attacks? And how do panic disorders differ from occasional panic episodes? Today, we're exploring the anatomy of a panic attack and the science behind panic disorders. Stay tuned to uncover tools for reclaiming calm.
Welcome to Precooked Psychology, where science and storytelling meet to make sense of the human mind. Today's episode dives into the intense and often misunderstood world of panic attacks and panic disorders. We'll explore what happens in the brain during a panic attack, what sets apart a disorder, and what evidence-based strategies can help. Ready? Let's jump in.
A panic attack can feel like a body-wide alarm system gone haywire. Symptoms like chest pain, dizziness, or a racing heart often lead people to believe they're having a heart attack. But at its core, a panic attack is the brain's fear system, the amygdala, going into overdrive. While anyone can have a panic attack in response to extreme stress, panic disorder is different. It's a recurring pattern of attacks that are unpredictable and often lead to persistent anxiety about future episodes. Imagine constantly living with the fear that an attack might strike at any moment. This fear often leads to avoidance behaviours, skipping social events, avoiding public spaces, or even staying home entirely. So, what causes panic disorder? It's a combination of biological, psychological, and environmental factors. Studies show that anxiety disorders, including panic disorder, often run in families, suggesting a strong genetic component. If you have a close relative with panic disorder, your likelihood of developing it increases. Beyond genetics, an overactive amygdala, the brain's fear center, plays a significant role. This hyperactivity triggers the body's fight or flight response, even when there's no real danger. Neurotransmitter imbalances, particularly in serotonin and GABA, can further heighten sensitivity to stress and fear.
Did you know that around 2 to 3% of adults in the US are affected by panic disorder each year? Although the condition can feel overwhelming, it's also one of the most treatable anxiety disorders. With tools like therapy, mindfulness, and medication, many people find relief and regain control over their lives.
Childhood experiences, such as trauma, neglect, or significant loss, can also set the stage for panic disorder by shaping how the brain processes fear and stress. Cognitive vulnerabilities, like catastrophic thinking, further reinforce the cycle. Someone might interpret normal bodily sensations, like a rapid heartbeat after climbing stairs, as catastrophic, amplifying fear and perpetuating the disorder. But here's the good news. Panic disorder is highly treatable, and several evidence-based strategies can help. Cognitive behavioral therapy, CBT, is one of the most effective approaches. It helps individuals identify and reframe the catastrophic thoughts that fuel panic. For instance, someone who believes, "I'm going to lose control," learns to replace this with, "This is my body responding to fear. It will pass." CBT often includes exposure therapy, where individuals gradually face their fears in a controlled environment, reducing avoidance behaviors and building resilience. Mindfulness meditation is another powerful tool. Emerging research shows that mindfulness can interrupt the panic spiral by teaching people to stay present. Practices like deep breathing, body scanning, or grounding exercises help reduce the brain's reactivity and restore a sense of calm. Over time, mindfulness can rewire the brain, making it less prone to overreacting to perceived threats. Another highly effective technique is interoceptive exposure therapy, which focuses on reducing fear of bodily sensations. By intentionally recreating mild panic symptoms, such as hyperventilating or spinning to feel dizzy, individuals learn that these sensations are not harmful. This practice helps desensitize the fear response and builds tolerance to sensations that once felt overwhelming. In some cases, medication can be a helpful addition to therapy. Selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed to regulate mood and anxiety, while benzodiazepines may be used for immediate relief during acute episodes. However, these are typically paired with therapeutic interventions to address the root causes of panic. Panic attacks may feel like they hold you hostage, but understanding their anatomy gives you the power to reclaim control. Whether through CBT, mindfulness, or gradual exposure, there's hope for relief. Progress begins with small steps, seeking help, challenging your thoughts, and practicing presence in the moment. As we close today's episode, remember this: just as storms pass, so too do panic attacks. And with the right tools and support, calm is always within reach.
Wise words for sure. And that all for this episode of Precooked Psychology. If you found today's discussion helpful, subscribe, share, and join us in keeping the conversation about mental health alive. Until next time, take care of your mind